My name is Darnell Johnson. I am the housing case manager here at Quest Center for Integrative Health. I was in a 4-month program to get sober from drugs and alcohol. Residential was just the stop. Like, stop, sit on your hands, don't do anything. And then Quest was more, now who do you want to be? Who can we help you be?
I've been coming to Quest for almost 18 years and found out about the WOW group that Quest was facilitating for HIV positive women. But it was life-changing. At the time, I was very much on drugs. I was prostituting, a sex worker, didn't have my daughter in my life.
Both my hips are bone-on-bone arthritis, plus I've got something going on with my back and fibromyalgia. If I were still suicidal thinking, I would be there right now. I was down and I was fighting because I've got Quest.
Clients today are more complex. They may need clinical needs, they may need medical care, they may need a whole bunch of family sort of system care. There's this lack of services and a high need for them.
We don't have enough Quests. We don't have enough alternative resources for people to engage in. It is a crisis.
How do we come together and combine all of those complex issues to create a system of care? And I think that that's where Quest comes in.
FSR, or Finding and Sustaining Recovery, is an intensive outpatient program. Driving to the Quest house was terrifying. All I knew was that the house was LGBTQIA2S+ specific, and that they had a bed there for me.
We would come and meet, share, eat, and sometimes also get education about medication. But they were so happy. I remember hearing them laughing, and I was like, what the fuck is so funny? Right? What the fuck's so funny? They got HIV. What's so funny? But it was great, and I learned a lot. Things were gonna get better because there was just so many examples of the women that persevered, and it just helped me put one foot in front of the other.
When I started, I had no idea anything about acupuncture. My doctor sent me for pain management. I literally could not cross the street. I was in that much pain. And at 20 months, I walked all the way across to the grocery store. So it was just amazing that realization that this stuff is for real and it works.
Also, the services with Quest were offered. So like acupuncture was offered to the Women of Wisdom group, therapy and things like that. So we had access to the other programs within Quest.
Everything there is that you can think of healthcare-wise is here.
And that's what we have to create as a system for behavioral health, is the opportunity to meet the individual where they are at and then offer them traditional and non-traditional supports.
Everybody is accepted, and so I learned self-acceptance.
The house being LGBTQIA2S+ specific is absolutely everything. It means safety in who I am. It was the very first place that I felt fully safe to be myself and also to get to know myself.
And so whenever you can give a person who feels that sense of belonging, then the chances of them coming back becomes greater. Quest has always sort of been in tune with the population that they serve.
Just having made it to 4 years sober on the 10th, I get to show up, and my family and my friends know me to show up. And that's one of the most beautiful things for me. When I first came to Quest and really got to know our housing case manager as a client, I thought, wow, wouldn't it be so cool if I could do that one day? And when I was offered this position, I just was like, now I get to carry on that same hope that she gave me just by doing her job.
I went to my hairdresser I'd been going to for well over 30 years. My entire demeanor had changed. I had become totally positive. She went to the door and she's like, "What happened to you?" Instantly, I said, Quest.
I have a good relationship with my daughter-in-law. They trust me to keep my grandson. Yeah, life is good. Everyone's going through something, and I think how I've changed how I approach getting to the other side, and Quest has helped me with that. I didn't like myself when I first got here. I didn't. I had to start liking myself until I really turned a corner. Now I love myself, but it took a minute.